According to health surveys, about 3 crore people in India suffer from neurological disorders. These include epilepsy, stroke, Parkinson's, traumatic brain injuries, and neuroinfections. Although neurosurgeons and hospitals across India have made considerable progress in neurosurgical diagnosis and treatment, yet brain disorders often go undetected, which leads to delay in treatment strategies. To overcome this shortcoming, researchers at the Indian Institute of Technology, Mandi, have developed a method that helps in locating and classifying lesions in the brain that lead to neurological diseases. Using this method, the diagnosis can be done quickly and accurately.
The device is used for stimulating the neurovascular system of cerebral tissue while simultaneously recording the neuronal and hemodynamic responses. The device can be used for the care of various neurovascular disorders including ischemic stroke at the point of care and serves to help the people in the rural areas who are deprived of healthcare facilities normally accessible to people in bigger towns and cities.
Neuro-Vascular Coupling or NVC involves complex interactions between neurons and blood vessels that regulate blood flow to the brain. When nerve impulses do not trigger the required blood flow, neurovascular uncoupling occurs. It leads to narrow or blocked blood vessels, leading to decreased blood flow and ischemic stroke. Studies show that 85% strokes are ischemic stroke. That is why it is important to assess the status of neurovascular coupling for the prevention, diagnosis, and treatment of such diseases. For this, researchers at IIT Mandi used a multi-modal brain stimulation system. They combined electroencephalography and near-infrared spectroscopy into an integrated device that allows to measure the nerve action and brain blood flow at the same time. The NVC problems can be identified immediately by feeding the acquired data into mathematical models. The method can pinpoint the actual location of the NV uncoupling. The device can also help in identifying the progress of diseases such as Parkinson's and can predict occurrence of these diseases even before the appearance of the symptoms.
The basic mechanism of STTD device is to increase or decrease the neuronal excitability. This type of user-specific technology reduces the burden of the patient to regular visit to the neurological institutes. Such type of the technology strives to gift back a patient for a much normal and independent lifestyle.
The technique makes it easier to decide the course of treatment quickly in stroke and hypertension cases. Under the leadership of Dr. Shobhajit Roy Chaudhary, the research was conducted in collaboration with Dr. Abhijit Das, a neurologist at the Institute of Neurosciences, Kolkata, and Dr. Anirban Datta, an assistant professor from the University at Buffalo, USA. The study has been published in the IEEE Journal of Translational Engineering in Health and Medicine, and the team has also recently been granted a US patent for the invention.